Welcome to segment 2, protected health information. So let's just start with our case scenario for today. So a news reporter called a local physician asking about the prevalence of influenza and about the symptoms that the patient experienced over the past 6 months. So what do you think about that, Henry?
Before I answer that question, let's talk about protected health information. This refers to any information related to the patient's past, present, or future health conditions. This can be in any form, written, spoken, or electronic. There's a list of 18 individual identifiers on the screen that are considered protected health information. Before we disclose patients' information, as in this scenario, we need to make sure that we de-identify their information. To do this, we can do one of two things. We can remove the 18 individual identifiers, or we can encrypt the information. HIPAA is concerned with keeping the patient's information private and secure. There are a number of laws associated with HIPAA, and Dr. ElGasim will be discussing those laws.
HIPAA Act has been launched in 1996, and the main focus for HIPAA Act is to ensure patient information privacy, security, and to regulate how patient information to be disclosed, when and where and how, and to maintain the patient's right to access his information. HIPAA Act is flexible, so it can be used in a clinic with one reception or in a big hospital with thousands of beds. That's why many hospitals or institutes has their own policy and regulations to adapt HIPAA Act. The covered entity by HIPAA Act including different healthcare provider, healthcare plans, and hospitals.
Let's talk about protected health information in medical practice. Dr. ElGasim, there are a number of scenarios that we come across from day to day in medical practice. Let me give you one. Let's talk about a medical student who would like to do a research project, and he's asking to photocopy the patient's health records for that purpose. What do you think about that?
First of all, the information that the students want is a protected health information. So it has to be authorized by the patient, and we will address that in another segment. After the patient gives the authorization to share the information, this information should be de-identified. So the identification should be done by making sure that this information does not include any one of the 18 identifier or can be coded for the research purpose.
Good.
So after we are sure that it's de-identified, the students can take it for the research purpose, and the research for sure need to be approved from the research ethics committees.
Good. Another scenario would be that of the medical students who document the patient's names or even bed numbers and ward in their books when they're doing interviews with the patient.
So that's a good question, actually. This is actually considered, it can be a source of HIPAA violation, because that's the students can lose his note anywhere, and this information is no longer protected, especially if it contains sensitive information. So the students should refrain from writing a complete patient note or any one of the identifier as a part of their data collection, because we at this point we won't be able to guarantee that this information is secure and confidential.
Good. Now we'll give you an opportunity to answer the question associated with this segment.